Opioid abuse often begins innocently from drugs prescribed by a doctor.
Seth Kaplan shares how a patient and a team of doctors decided to go a different route to control pain.
Takes the high snap.
I was playing long snapper.
In a home game for Chambersburg against State College last fall.
And as a long snapper, you're kind of the first one down the field to cover the returner. And when I went to tackle the returner, my knee kind of just twisted awkwardly and I fell right onto the ground.
There's a Chambersburg player down on the field. I believe that's number 64, Brandon Vaughn.
I knew there was definitely something wrong.
So did Brandon's mother, Penny, watching from the stands.
He was down the field from us, but we knew it wasn't going to be good. And we were just praying.
It starts with an evaluation on the sideline, and we identified him as someone that probably needs to get an MRI.
Dr. Michael Day, a WellSpan orthopedic surgeon.
So we brought him into the clinic and found out he did have a anterior cruciate ligament rupture.
I remember when Dr. Day came into the room and he said that it was a torn ACL, and it was really tough news.
Surgery, a long recovery, sometimes painful rehabilitation.
Maybe 10 years ago, what I would have done would be to prescribe enough opioids to cover any amount that someone might need.
What almost any surgeon would have done, dozens of pills.
So we started off with 60.
Even though most patients didn't use nearly that many.
So, okay, well, let's prescribe 15 pills.
Still,
I noticed that a lot of the athletes, particularly high school athletes, they were taking 1 or 2 or 3. So then I decided, well, let's start off with no opioid.
You heard that right, not just fewer pills.
We're talking about opioid free.
I had heard, other people and their experiences and the type of medicines that they had to take. I didn't really know exactly that was even an option initially, that I could just go through surgery, the process afterwards without taking opioids.
I knew it was going to be tough without it, but with him being so young, I'm like, he can do it.
And we have a lot more conversations with the patient about pain management.
The opioid-free approach has to be a team one, including physical therapists like Karen Lee.
Good, how's that feel?
Feels good.
Yeah, awesome. We're managing pain, and if we're not, we're talking to the surgeon to give them updates and make sure that he's having a successful outcome as he did.
I'm pretty much back to normal and I can do about anything I want to.
Including athletics, with a focus on a different sport.
I'd like to pursue a career in a collegiate career in golf.
If the opioid-free approach sounds unusual, that's because it is for now.
It's still not standard, and I think the vast majority of people would prescribe some opioid.
It feels good knowing that I'm contributing somehow to other individuals who tear their ACL and maybe create other protocols compared to the traditional way.
In Chambersburg, Seth Kaplan, ABC 27 News.